Good evening, everyone. After a long period of time, I'm going to again put my video, and the topic of my video today, which I will going to discuss with you, is on drug dependence and management. I will discuss with you caution in prescribing dependence, drugs likely to produce dependence and management. First of all, before discussing with you the drugs which cause dependence and their management, I want to discuss with you what is drug abuse. It is the persistent excessive use of drug inconsistent with or unrelated to medical or social practice. It is labeled as drug abuse. When there is persistent excessive use of the drug is there, inconsistent with or unrelated to medical or social practice, which is unrelated to medical and social practice, which is excessive use of the drug is there, that is the drug abuse. And basically this may include the use of illicit drugs like LSD, cocaine, cannabis, volatile substances, and inhalant abuse. With all the illicit drugs, they can lead to drug abuse like LSD, cannabis, cocaine, volatile substance, and inhalant abuse. Now, drug habituation. It is the pattern of repeated drug dosage, though actual physical needs is minimal. Means though the physical needs are minimal, but the patient or the person is taking repeatedly, the drug is taken by the person, though the actual physical needs they are minimal. Therefore, there is no desire to increase the dose of the drug taken, and discontinuation of drug use is not associated with withdrawal syndrome or compulsion to procure the drug. Means there is no desire, means the person is taking habitually, the person is taking repeatedly the drug dosage. There is no requirement of increase in the dose of the drug, and there are no withdrawal symptoms which come when we discontinue the drug, and this compulsion to procure the drug. And the example is caffeine, which is present in coffee, and nicotine, which is basically present in the tea, or theophylline, which is present in the tea. They basically cause the drug habituation, that is the repeated use of the drug. Drug dependence on the drug means the body has become so used to having the drug regularly that it needs that particular drug to function normally. Means the person is so used, has become so used to take that drug that he requires that drug to for basic normal function of the body. And if it is stopped, the person will feel one unwell. Means if the drug taking is stopped, the person will there is impulsive need of taking of the drug to the person for the normal function of the body. And when the person stops taking the drug, the person will feel unwell. What are the drugs which cause dependence? These are nicotine, morphine, heroin, cocaine, amphetamine, and cocaine. Nicotine is the cholinergic drug. Morphine is the opioid analgesic. Heroin is the opioid analgesic. Cocaine and alcohol are CNS stimulants, and cocaine and amphetamine are the CNS stimulants, and alcohol is CNS depressant. Now, what is psychological dependence? It means that the person has a craving or is compelled to use a particular drug to get pleasure or to stop from feeling bad. Means the person has the craving or he is compelled to use a particular drug. Why? To get pleasure or to stop feeling bad. Even though it may be dangerous to take the drug, the person he has the craving or he is compelled to use a particular drug to get pleasure or to stop from feeling bad. It is less serious, and abrupt discontinuation of the drug does not produce withdrawal syndrome, with though emotional discomfort may occur. Example, amphetamine, cocaine, cannabis. Now, this is less severe, and abrupt discontinuation of this drug will not lead to withdrawal symptoms. Means there will be no withdrawal symptoms when we stop taking this drug. And though emotional discomfort can occur, like amphetamine, cocaine, cannabis, these are CNS stimulant drugs. They cause the psychological dependence in which the person is having the craving or is compelled to use to seek pleasure or to stop feeling bad. though it may be dangerous. The physical dependencies, if the drug is stopped suddenly, the person gets withdrawal symptoms. It means that the person, if the drug is stopped suddenly, drug is stopped, the person will get the withdrawal symptoms. What are the symptoms of heroin dependence? Heroin, which is the opioid analgesic drug. What are the symptoms of heroin dependence? This is sweating. They can be sweating. They can be feeling hot and cold. Then there can be runny eyes and nose, means there can be lacrimation, there can be salivation, sweating, yawning, anorexia, loss of appetite, stomach cramps, nausea, diarrhea, tremor, there can be poor sleep, and restlessness, and general aches and pain, general body pains can occur. Now, what's the difference between psychological and physical dependence? Basically, psychological dependence is caused by the CNS stimulant drugs like amphetamines, cocaine. Physical dependence is caused by CNS depressant drugs like opioids, barbiturates. Psychological dependence is of mild type. Physical dependence is of severe type. There's no withdrawal syndrome. Withdrawal symptoms are not seen in the psychological dependence, but withdrawal syndrome or abrupt discontinuation is seen with the physical dependence. Psychological dependence has the positive reinforcement. That is, the drug dependent take the drug for pleasure. Means the drug dependent, the person who is taking the drug, he will take the drug for pleasure. Negative reinforcement means the drug dependent takes the drug to avoid unpleasant withdrawal syndrome. Negative reinforcement, that is in the physical dependence, the person is having negative reinforcement, that is the person is taking the drug out of unpleasant to avoid the unpleasant withdrawal syndrome. Now, what is drug addiction? If a person is addicted to drug, there's an excessive craving and uncontrollable and compulsive use of that drug. Because if the person is addicted to the drug, there's a person and he's addicted to the drug, what is there? That is, there will be excessive craving and there will be uncontrollable and compulsive use of that drug will be there. And some people, they're more likely to develop addiction than others and seem to be particularly sensitive to cravings. Accordingly, some people, they're more sensitive to cravings, more sensitive to drug addiction than the other persons. Now, which are the drugs which are basically which cause the dependence? Such as the drugs which cause the dependence. These are CNS depressants like opioid analgesics like opioids, narcotics, sedative hypnotics like barbiturates, benzodiazepines, tranquilizers, and alcohol. These are the CNS depressant drugs. Hypnotics and sedatives are widely used. Sleeping pills, daytime sedatives. Abuse of these drugs is common. Diazepam, alprazolam, which are benzodiazepines, they produce physical dependence. Means in the sedative hypnotics, which are used as sleeping pills and daytime sedatives, we can give the diazepam, alprazolam, which can cause the physical dependence. And benzodiazepines and barbiturates, what they do is they depress the reticular activating system in the brainstem, causing intoxication. Sudden withdrawal of the drug results in restlessness, hypotension, convulsion, and delirium. Means benzodiazepines and barbiturates, they depress the reticular activating system in the brainstem, and that causes the intoxication. And sudden withdrawal of the drug results in restlessness. The withdrawal symptoms will be of the benzodiazepines and barbiturates will be restlessness, decrease in the blood pressure, convulsions, seizures can occur, and delirium can occur. Under CNS stimulants, the drugs are antidepressants like SSRIs, selective serotonin reuptake inhibitors. The fluoxetine drug is the antidepressant drug. Amphetamines, methylphenidate, and cocaine. These are CNS stimulants. What they do is they produce the wakefulness, increase the alertness, exaggerate activity, and the sense of excitement and power is there. Because there will be exaggerated activity, there will be sense of excitement, and there will be a sense of power, and increased alertness will be there, and wakefulness. And these drugs, these CNS stimulant drugs, the symptomatic effects of these drugs are there can be dilatation of pupils, there can be tachycardia, there can be increased systolic blood pressure, there can be hypoglycemia, and there can be bronchodilation. Means there can be dilatation of pupils, increase in heart rate, increase in blood pressure, hyperglycemia, increase in glucose levels, and bronchodilation. Cocaine is the opioid, it is the narcotic drug by law, and it is a topical anesthetic, and it is abused in the form of chewing coca leaves and sniffing and intravenous injection. Now, how the medicines help the drug dependence? Now, these are the drugs I have already discussed with you, the drugs causing the drug dependence. Now, why we stop the or what the medicines which we give to stop the drug dependence and how they act? What is their mechanism of action is? What are their objectives are? The medicines which help against dependence are they reduce or prevent the withdrawal symptoms. They will prevent the withdrawal symptoms like in drug addiction, in the physical dependence stabilize the person's drug use and lifestyle trying to break drug use. Means the craving in the patient will be avoided. Means the stabilize the person's drug use and lifestyle trying to break the drug use. In long term to change person's drug taking and any risky behavior. To change the risky behavior of the person, drug taking behavior of the person. Other medicines may be prescribed to treat withdrawal symptoms like some drugs like alcohol, which is a serious depressant drug, which can lead to hallucinations. And to treat those hallucinations, which is the withdrawal symptom of the alcohol, which are false visual and auditory perceptions, we can give antipsychotic drugs like haloperidol and olanzapine. Now, available medicines to manage drug dependence, these are opioids. For the opioid poisoning, we have methadone, which is the longer-acting opioid, buprenorphine, which is the longer-acting opioid, lofexidine, and naltrexone, which is opioid antagonist. Why? To treat the withdrawal symptoms, the opiate withdrawal and dependency. Stimulants के लिए we have cocaine and amphetamines. Stimulants, cocaine and amphetamines for them, the CNS depressants will be the withdrawal symptom reduction will be caused by the CNS depressants like benzodiazepine, which is longer acting diazepam. Longer acting benzodiazepine is the diazepam to reduce the withdrawal symptom to calm down the patient. Antidepressants to treat the depression and dexamphetamine to treat dependence on the amphetamines. Antidepressants can be given to treat the underlying depression in case of the stimulant drugs. Alcohol, for the alcohol, we have the drug to treat the symptoms, that is the withdrawal symptoms. For the withdrawal symptoms, we have the two drugs like chlordiazepoxide and carbamazepine, and the opioid antagonist, which is naltrexone, and disulfiram, which is the aldehyde dehydrogenase inhibitor drug disulfiram. It is prevent the drinking alcohol, which it reduces the craving. Naltrexone will reduce the craving of the alcohol, and disulfiram it is the aldehyde dehydrogenase inhibitor. So it will lead to increase in the levels of acetaldehyde when the patient is on alcohol, and when the levels of acetaldehyde increases in the body, that can lead to very unpleasant symptoms like there can be tremors, palpitations, flushing, headache, and sweating can occur. All these symptoms can come when the patient takes disulfiram along with alcohol and because of accumulation of acetaldehyde in the body. And so this stops the patient from taking the again repeated dose of alcohol. Available medicines again for the benzodiazepines, we have the long-acting diazepam, which treats the withdrawal symptoms. Nicotine, we have the nicotine replacement therapy, which is available in the patches, gums, sprays, and bupropion, which is the antidepressant drug, which is the atypical antidepressant. It can treat the nicotine dependence. Varenicline, which is the cholinergic partial agonistic drug, nicotinic partial agonistic drug. It can also treat the nicotinic dependence. Now, how they treat the drug dependence? These drugs for the opioids, we have the drug. They treat the dependence of the opioid. How they reduce the withdrawal symptoms, reduce the risk of patient to the harm caused to the person and community. Once stabilized, dose may be gradually reduced with aim of stopping altogether. Means we give the opioids. We give the for opioids. We have to treat the withdrawal symptoms. We give methadone, buprenorphine, which is the longer-acting opioid, to treat the withdrawal symptoms. And slowly, the dose of these opioid drugs is slowly decreased and slowly stopped. Stimulants. Now, for the stimulant drug dependence, we have the drug diazepam, which is the depressant drug, longer-acting depressant drug, which can be given for 2 weeks. Psychological therapies can be given. For the alcohol, we can give the disulfiram, and for the antidepressants, we can give antidepressants for depression of the CNS, and beta blockers to treat anxiety as withdrawal symptom. Beta blockers, now the withdrawal symptom of anxiety can come, so we can treat that drug with propranolol, that symptom with the propranolol beta blocker. Alcohol detoxification, high dose of fludiazepoxide or diazepam for first day of stopping the alcohol. Now, for the first day of stopping the alcohol, we will give fludiazepoxide or diazepam, which is a longer-acting benzodiazepine we can give, uh, and which will reduce the withdrawal symptoms. And dose reduced over 5 to 7 days. And to reduce the craving, we give acamprosate, which is the anti-epileptic drug, and naltrexone, which is the opioid antagonistic drug to reduce the craving. Disulfiram as leads to accumulation of acetaldehyde in the body, as it is the aldehyde dehydrogenase inhibitor. So, alcohol and disulfiram can produce unpleasant symptoms like flushing, vomiting, palpitations, headache, and this will prevent the patient from taking the further alcohol. Nalmefene, which is the partial agonist of opioids, it can also reduce the craving. It can cut down the excessive alcohol intake. Now, benzodiazepines and non-benzodiazepines, these dependence can be avoided by giving the longer-acting diazepam of equivalent dose of the drug given, and slowly the drug is reduced for up till 1 to 2 weeks and finally stopped. Gradually, the dose is given, slowly the dose is reduced, and then gradually just stopped. Now for the nicotine, we have three therapies like nicotine replacement therapy, bupropion, and variolicerin. Nicotine replacement therapy, it is given, some people prefer to stop smoking at the end of one day. Now there's one person is on smoking, and at the end of one day, he will stop smoking and start nicotine replacement therapy when wake following day. Others prefer to use nicotine replacement while still smoking. Some use it after smoking, some along with smoking, they use a nicotine replacement therapy, and this is used for 8 to 12 weeks. Bupropion is started one tablet each day for 6 days. One tablet each day is given for 6 days, then increase to one tablet twice a day. Then twice a day we give the one tablet. Then we need to stop the target date to stop smoking. Set a target date to stop smoking until 1 to 2 weeks after starting treatment. Then we stop the smoking after 1 to 2 weeks. This allows bupropion to build up in the body before one stop completely. Before one stop completely, uh, we to build up in the body, we have to give the drug 1 to 2 weeks before stopping. Penicillin is started 1 week before quit date. It is started 1 week before quit date. Start with low dose and build it up over following 11 weeks. The slow dose में start करते हैं, and 1 week before quit date is started, and we have to give for the 11 weeks. Course of treatment is 2 weeks. Thank you. That's all for my discussion on drug dependence and management of various drugs which cause the drug dependence. I hope you like this video. And if you like this video, and if it is helpful to you, and if it is useful to you, kindly subscribe to my YouTube channel. That's Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, be safe, happy learning. Thank you. Happy learning. Thank you.